medical and healthcare education and ultimately improved patient care and safety. Well, that's what the folks at EVMS are working on, and here to explain more about that, joining us is C. Donald Combs, who is with EVMS. Thank you so much for being with us.
Well, thank you for inviting me.
Appreciate it. So let's talk a little bit about what we're talking about is the, I'm trying to get all the words right here, the National Center for Collaboration in Medical Modeling and Simulation. Big, long title.
That was carefully designed to roll off the tongue, for sure, but it is important. Simulation is a toolkit of technologies to educate and train people, and it involves sometimes people as actors playing patient roles. Sometimes it involves hand-eye coordination, like how do you do a suture.
Sure.
Sometimes training people on how to do an endoscopic exam where they're going down with a tube or working on a mannequin. And all of these technologies together allow us to teach in a way that is contemporary. It gets students involved, they're engaged, they're doing something. It's not just a lecture format. And the notion of the National Center is that you have experts in parts of the world who are building models of the knee, and others somewhere else building models of the ankle, and somewhere else building the connector between the knee and the ankle. And so we were looking to how could Eastern Virginia Medical School and the simulation industry in the region serve as a stimulus to bring all the pieces together, if you will, so that ultimately we can have total human simulation. The reason that's important is the way that we train now, for the most part, is the way we've been training for over 100 years. We practice on each other, and you don't want to see me for the first time. You know, you want to see me for the 1,000th time.
I don't want to be your first
one.
So
we're trying to develop technologies that are realistic, but they don't involve people. You can make mistakes. Fake patients can die, but you can learn what you did wrong, so when you deal with real people, you do it correctly. So the National Center is an effort to work with industry, not only, well, first of all, with Old Dominion University and their engineering and their simulation programs, our medical expertise, and to say, can we help our industries build on their defense industry strength in simulation, diversify into healthcare, and bring some of their knowledge so that we can train people better sooner? Because you don't want a physician who functions at 75% competence. You want 100% competence.
Yeah, you definitely want 100%.
But how you
if you're the one they're operating on.
But how you test that is tricky. And so this technology not only allows people to practice in a way that doesn't hurt living patients, but it allows us to measure their competence in a way we've never been able to do before. And so at EVMS, we really have two programs, the Sentara Center for Simulation and Immersive Learning, which is oriented to our medical students, our physician assistant students, and others in training in a variety of ways. And then this National Center that's more a regional outreach program.
So how far are we reaching with the outreach on this? I mean, because it sounds like
we're working with companies as big as Lockheed, which is the largest defense contractor in the world. And so they have international reach, and we're working with companies that are regional, like Mimic and Simis, that are local companies, trying to develop new ways of training, new ways of assessing competence, and we're having a lot of success in that. The students love it, again, because from a learner perspective, sitting there and listening to me talk as a talking head, which I can do, by the way, for 3 hours with no problem.
But I would imagine hands-on really is great education.
Much better.
So what's the kind of reaction that you're getting from the students?
Oh, they love it. They can hardly get enough of it. And but the more important thing is we're able to look at a range of skills, so that, for example, one of the criticisms of the healthcare providers is their communication skills aren't all they should be. And that's because
that bedside manner?
Well, it's also a function of our education system. I mean, if you look at what we do most in communication, we listen most, we speak next, we read next, and we write least. But if you look at what the schools do, they teach them in exactly the reverse order. And so we have simulations that involve interacting with patients families, with providers, and so we're able to improve students' history taking, interviewing skills, their capacity to break good news or break bad news. We've started training programs not only for our own students, but also with companies like LifeNet, which is in the organ donation business, and how to have that discussion with potential donors and donors' families. And so the applicability of the human simulation piece that we do is really not limited to medicine. And so we're interested in finding ways to expand that. On the other hand, It's nice if somebody is learning suturing, that they do it in a straight line so you don't look like Frankenstein.
that is nice, yes.
So we have simulations at a very technical level as well.
Oh, that's amazing. So, but you're right about having to deliver news, things like that. You don't think about that. I mean, you know.
Well, and some people do it naturally, but most don't.
Sure.
And so if you can work them through 2 or 3 times, and if you can use television playback, because people will say, I didn't do that. And then you see yourself on television and you say, oh, well, okay, I guess I did.
Live. Yeah,
that's
true.
Right. That's right.
Well, Dr. Combs, thank you so much for telling us about this. This is amazing. It sounds like it's going to be a program that just keeps growing, and it's great that we have it right here in our own backyard.
I think the potential is enormous. I think it really is, and I appreciate you having me on the show.
All right. Well, thank you, and thanks for telling us about it. Right. And we'll keep watching EVMS, keep growing and
Please
growing.
do.
All right. That's going to wrap it up for this week's edition of Dialogue. I'm Sandra Parker. Thanks for joining us. We'll see you again next week. Have a good